Friends, it's time to know our bladders and know our prostate by a different understanding altogether. For all men in the age group of 40s to 60s, there's a very silent and a progressive change which happens in the urinary health that is under our control. The progression of change in the hormones in men brings about two changes. One is on the erectile function going down and causing erectile dysfunction. But more commonly and very silently are changes happening as a result of hormone in the level of the prostate. Now, prostate is a male gland, is a gland that is actually at the exit of the urinary bladder. The urinary bladder at the bottom of your abdomen stores urine. As the kidneys produce urine, the bladder is going to continue to store urine, and this storage brings about progressive sensations. When the bladder is good full and too full, and you want to go and pass urine, the bladder then contracts and pushes urine out. The passage opens up, and urine comes out to the male organ called the male urethra. This understanding between the bladder and the prostate has been there since birth. Bladder storing urine and contracting at a social point when it wants to push urine out as you are in the washroom, and the passage opening up, which is undergoing a change. So, the hormone related change at the level of the prostate is going to happen to all men in their 40s to 60s as an early phenomenon. We get to see our fathers and our grandfathers in 60s to 80s continue to progress on the suffering of poor urinary health or obstruction to the flow, but the younger men can pick it up early. So, isn't it time for us to wake up to the phenomena of saving our bladder, which is actually working silently and relaxing and contracting in the background of a progressive change happening at the level of the prostate? So, prostate is gradually getting occluded, the urinary passage is getting narrower, as a result of which, year by year, decade by decade, the urinary flow gradually goes down. Some people pick up this phenomena early and they come and complain to their urologist in our cities and our countries where the flow is gradually going down. So, many in their 40s to 60s, if they complain of obstruction to the flow of urine, urine is not coming out well, you don't empty your bladder completely, the stream is very thin, and you have to go again and again because the bladder is now learning a phenomenon of contracting against an obstruction. It is time for us to wake up to see our urologist. Why should we see this early change? Because we need to understand that bladder is a silent performer. The urinary bladder is a silent performer going through the crusade of filling up, and you are the boss who decides when you want to pass urine. So you can sometimes postpone urination, and progressively there's a change happening in the prostate at that age group, which is starting from 40s, 50s to 60s, 70s, and then 80s and 90s. Early pickup is the key to the entire success of maintaining a great urinary health and obviously saving the bladder. The bladder silently is contracting again and again in the background of obstruction and may not be able to empty forever if you don't relieve the obstruction in time. So, a stitch in time saves nine. In other words, if we are able to identify ourselves very well, we probably will be able to take our journey on the prostate and urinary health and obviously saving our bladder much earlier than what could happen to us in a very delayed phenomenon. So, friends, saving the bladder is a requirement, is a need today because the bladder progressively undergoes a change, which sometimes can be irreversible years and decades later. A graceful aging of the bladder, coupled upon by this contraction process, which actually has to be progressively more and more, bladder overworking, looked like a thickened bladder wall on the ultrasound, is all about the bladder undergoing a progressive change in the background of a non corrected prostate obstruction. So, for all men, they need to know their prostate score. And that is actually given in the IPSS. That score available on the internet, the score available in various places. You can score yourself and know who you are. Knowing early is a key to a therapy where you will maintain health of organs which are not visible to you, which are not in public domain, and which is many a time missed out. So I think it's a wake up call and a shout out to all men in their 40s to 60s across the cities and countries where if you have a urinary complaint, don't postpone it. If you don't have a urinary complaint, then know your prostate score. So if you have a urinary complaint, you will see a urologist in your cities and your locations. If you don't have a urinary complaint and you're in your 40s to 60s, obviously we'll look forward to knowing your prostate score. That means we need to know your IPSS symptom score on the flow side and on the storage side as to how good have you adjusted progressively. And then we do it every annual to look at, we pick up things early. So, friends, knowing your prostate score would give us an idea about the obstruction to the flow of urine, your bothersomeness on urinary issues, which is very much visible when you speak, or invisible and you're progressing without your knowledge. It's like a report card which gives us an idea about our performance in the lower urinary tract, which we are progressively adjusting year by year, decade by decade. On the other side comes a phenomena where the bladder continues to suffer. And I'm talking about the urinary bladder, which actually has to contract again and again and again to push urine out, which is not happening anymore because the occlusion is only progressive on the prostate level or the prostate urethra. So, friends, it's a wake up call today for us to pick up things early towards a treatment and a cure. Let's not continue to be living with medications and continue to be obstructed. Let's not continue to be living with symptoms and postponing it to another day. And so, those people who have no complaints and are coming to health checkup phenomena across the country, it is important for us to look at our IPSS symptom score. If you're in your early 50s and beyond, a urologist would obviously like to see your PSA level, would like to see your sonography to know invisible things happening silently inside, which includes a residual volume staying back, hydroureteral nephrosis or kidney changes happening because of occlusion downstairs. The bladder overworking and getting thickened gives us a direct phenomena that there's a change happening. But actually, your report card is called uroflowmetry. The way you perform in the washroom in terms of bladder contracting and the passage opening is picked up by the ECG of the bladder, a graph which is called uroflowmetry. Metry is measurement, flow is speed, and euro is urine. So, urinary speed measurement of all men can be best done when they pass urine in a computerized toilet in a urologist's clinic. So this wake-up call today is important because I get to see at the Coquitlam Hospital over the last 17 years, young men coming progressively worsening. They coming with the fathers and grandfathers and looking at them and asking me questions. Will this happen to me too? Where I will live on a catheter, I may have to require a surgery. So friends, it's an era we live in where we are busy. We live in that prime of life in 40s to 60s where we sincerely miss out this phenomena. Isn't it time for us to wake up? Wake up to save our bladder, which actually cannot be reversed once it weakens up completely. A hypocontractile bladder, a weak bladder cannot be strengthened anymore. Then it requires a sacral neuromodulation by me to stabilize you and get you back to feet. So it's time for all men to wake up to a phenomenon of Save the Bladder campaign, which we run in terms of SaveTheBladder.com. We look forward to men joining this and understanding that it's time for us to wake up to the phenomenon. Let's know our prostate score. Let's understand our urinary health. Let's safeguard it today in 2025 to make a better 2026. Men, this is important for you to understand that hormone changes will progress in everybody's life. All men in their 40s to 60s undergo various hormone changes, and so why not pick up in time and take it forward to the next possible level by doing a uroflowmetry, by scoring yourself in knowing your prostate score called IPSS symptom score. Once you have done all that, you will see your urologist. You probably will look at a PSA level, you look at a sonography, and with all this, a digital rectal examination would safeguard you and put you back in the track on the society rather than letting you progress to a situation where the bladder is continuing to progress in an irreversible direction of a possible weakness and hypotonicity whose answers the mankind doesn't have. So let's save our bladder. Let's know our prostate score. Let's take it forward to the next level. And that is the dream phenomena that I take forward for all of you as we move forward in the next decade. Thank you so much.